Good people, welcome to our video today. Hope you're doing well. We promise to be giving you a video weekly, and today we are going to do a video on pneumonia, and we shall do pneumonia in children. That's the group that most of the time is are trouble with pneumonia. They get difficulties, the parents, and again, looking at the prevalence, pneumonia gets to kill a lot of our babies. So we handle pneumonia in children, and when I say children, I mean the age group between 2 months and 59 months. So we start, and generally I'll say in pneumonia we do say that majorly what you go to hospital with when you are diagnosed with pneumonia is what we call community acquired pneumonia. And for community acquired pneumonia, there are a number of organisms that are responsible for that, including Streptococcus pneumoniae, Haemophilus influenza, and other organisms. So in children, we'll have three classifications for pneumonia. One is when they have upper respiratory tract infections. So in that category, there is no pneumonia. Then when there is pneumonia, and last but not the least, severe pneumonia. So to start, for us to have pneumonia, there must be history of a cough or difficulty in breathing, accompanied by the factors that I'm going to give. So in cases of both pneumonia and severe pneumonia, we must have a cough or difficulty in breathing. Then now all those other factors is what will help determine whether it is pneumonia or severe pneumonia. In case there is a cough and no another feature, in case we're only having a cough, we don't have any feature that qualify as pneumonia or severe pneumonia, that is just upper respiratory tract infection, and that is the class that I said shall be non-pneumonia. So in all cases of pneumonia, we have a cough or difficulty in breathing. Remember, it is a cough or, it is not a cough and, it is a cough or difficulty in breathing. So if we have a cough or difficulty in breathing plus fast breathing, we have pneumonia. When we say that we are having fast breathing, we have fast breathing also divided into two groups. One, children who are 2 months to 11 months and between 12 months to 59 months. So for the children who are between 2 months to 11 months, it is equal or more than 50 breaths per minute. Equal or more than 50 breaths per minute. That is fast breathing. For children between the age of 12 months to 59 months, equal or more than 40 breaths. Equal or more than 40 breaths. That is fast breathing. So if we have history of a cough, difficulty in breathing, and lower chest wall in drawing, that is pneumonia. Or if we have a cough, we do not have, we have a cough or we have difficulty in breathing, then fast breathing, that is pneumonia. The other scenario, if you're having difficulty in breathing and chest wall in drawing, or the difficulty in breathing and fast breathing as per category, either equal or more than 40 breaths for the 12 months to 59 months, or equal to 50 breaths for the age 2 to 11 months, then we have pneumonia. And in cases of pneumonia, children just need to be put on amoxicillin, and you observe them. Somebody needs to be keen, because if they have pneumonia, chances are they're either going to respond well to medication, this is gone. If they don't respond well, we get to severe pneumonia. So mother needs to be informed of what are the expectations and what happens now that we can say we are now getting to severe pneumonia. In this case, you need to come back to hospital. We go to severe pneumonia, and in severe pneumonia we must have danger signs. And what are the danger signs that we are talking about? Either we have oxygen saturation of less than 90. So we are going to have what we said in pneumonia and severe pneumonia is present. What is that? That's a cough or difficulty in breathing, plus a danger sign. And what are the danger signs? So we have a couple of them. One, oxygen saturation of less than 90. Oxygen saturation, you use a pulse oximeter to measure. So if you get SpO2s of less than 90, that's a danger sign. A child who is not feeding at all, or who refuses to drink. Child who is not breastfeeding, who is not feeding, or refuses to drink, that's a danger sign. A child whose alertness is past A, that is, the child is not alert. We have a VPU at either V, P, or U, that is, the child is not alert. They either respond by verbal, pain, or they are unresponsive. That is a danger sign. Then, last but not the least, a child who is grunting. Yes, a child who is not grunting. Another danger sign that I've forgotten is central cyanosis. And mark this, it is central cyanosis, not peripheral cyanosis. You have two types of cyanosis: central cyanosis and peripheral cyanosis. For central cyanosis, we get it, where do we check for central cyanosis? Around the frenulum, around the oral cavity, yeah. With the peripheral cyanosis, we check for it at the fingers, and that's the only difference. And with that, we have all the danger signs. So the danger signs are 5. Number 1, oxygen saturation less than 90, child not feeding or not drinking at all, central cyanosis. We have a VPU at either VP or U. Then the last one is a child who is grunting. And for all cases of severe pneumonia, child must be admitted. On medication, we give a penicillin plus gentamicin. We also need to give oxygen therapy, and we give supportive care. And with that, my people, we have dealt with pneumonia. So with pneumonia, just to brainstorm, pneumonia, we either have 3 categories. It's either there's no pneumonia, there is pneumonia, or there is severe pneumonia. Now, for cases of pneumonia, we must have a cough or difficulty in breathing. Remember, it is not must have both of them, but either of the two. Cough or difficulty in breathing, accompanied by what to make it pneumonia. Either we have fast breathing, and fast breathing we have divided into 2. The children between 2 months to 11 months, more than 50, and children above between 12 months to 59 months, above or equal to 40 breaths, that is fast breathing. The other category is if you have either the cough and difficulty in breathing plus lower chest wall indrawing, we have pneumonia. Now, on to severe pneumonia. We said we have cough or difficulty in breathing plus a danger sign. And what are the danger signs? There are only 5. 1. SpO2s under 90. 2. We have grunting. 3. Central cyanosis. 4. A child who is not feeding or drinking. Then last but not the least, AVPU8, either VP or U. That is, the child is not alert. They are either responding to verbal, pain, or they are unresponsive. Nice time, my people. Thank you for watching. Subscribe.